This prospectus is on the effects of music on postoperative burn pain, and it's by Eaglin. Working in surgery and on the burn unit has shown me that postoperative burn pain is extreme and sometimes not controlled by meds. This led me to think about extra interventions that nurses could implement to help their patient through the process. One of these interventions is music. Music has been shown to decrease pain levels and decrease amounts of pain medications needed. The aim of this study is to examine the effectiveness of music on postoperative burn pain. The purpose of this study is to discover the effects music can have on pain levels and medication usage in postoperative burn patients. The significance of this study is that finding non-pharmacological methods of reducing pain that nurses can implement is important in this patient population. Given the success of music therapy in other surgical patients, it needs to be discovered if similar outcomes can be expected in burn patients. Kolkaba's theory of comfort is used as a framework for this study, and this theory, comfort, is the desirable outcome of holistic nursing. If the comfort needs are met, the patient experiences relief. This can happen in 4 areas: psychospiritual, physical, sociocultural, and environmental. Music can have an effect on the environmental, physical, and spiritual side of patients. The literature review included studies about the effects of music on general, orthopedic, gynecological, and cardiac surgery patients. The results showed that there was a significant decrease in pain, even if for a short time. There was a decrease in pain medication usage. Patients preferred to choose their own music rather than being subjected to someone else's choice of music. And pre-op teaching about how to use the music therapy is very important. The independent variable of this study is music therapy with standard care versus just standard care. Dependent variables will be pain level and amount of Dilaudid usage. I chose Dilaudid because this is the drug most often used postoperatively on the burn unit. The question is, what effect does music therapy have on pain level and medication amount of postoperative burn patients? It will be a randomized, controlled, pre-test, post-test study with a cumulative measurement of medication usage. Sample size is 30 participants in the control group and 30 participants in the intervention group. The setting will be Our Lady of Lourdes Burn Unit in Louisiana. The assumption of this study is that pain levels and pain medication usage will be decreased in the music intervention group. The limitations are the fact that this study will only contain burn patients, no patients needing more than 1 surgery, and pregnant patients due to the fetus safety with anesthesia. Limitations included in this study are the fact that patients can be interrupted mid-intervention, results will come from only 1 hospital, commercials are sometimes used during Pandora, which will be used to play the music for this intervention, and some patients do not find Pandora to be user-friendly. Inclusion and criteria include the fact that the patient needs to be inpatient for 3 days, they need to only have 1 surgery, and they need the ability to understand the pain scale that will be used to rate their pain. Exclusion criteria are allergies to Dilaudid, which will be used in this study, drug abuse, chronic pain, and the hearing impaired. The method of choosing which patient will go to either group will be the day of surgery. Those going to surgery on Monday and Friday will be considered in the control group, and those going to surgery on Tuesday and Thursday will be in the music group. Approval from the hospital will be obtained, and informed consent will also be obtained from each participant in the study. Demographic data will be collected from both groups pre-intervention. Each group will complete a pain visual analog scale preoperatively. Once on the day of surgery postoperatively, a visual analog scale will be completed after 30 minutes of music in the intervention group or 30 minutes of standard care with ambient noises in the control group. Each group will complete 3 more visual analog scales in the coming days. In the morning, in the afternoon, and once before bed on each postoperative day, they will follow the same pattern of music or no music for 30 minutes. On day 3, they will complete a visual analog scale with no music intervention in either group. On day 3 as well, the cumulative Dilaudid usage will be totaled. The plan for analysis is to use descriptive statistics for the demographic data, and repeated measure ANOVA for the pain levels, and independent group t-test for medication usage. These are the references that were used in this prospectus. Thank you for your time, and I hope you enjoyed this presentation.